Hey everyone, it's Amanda with My Life, My Way. Welcome back to TTC Tuesdays. To all of my Canadian followers, happy belated Canada Day. And to all of my American followers, happy July 4th and happy Independence Day. This week for TTC Tuesdays, I wanted to talk about PCOS or polycystic ovarian syndrome. The reason I want to talk about it kind of first when I'm looking at reasons why you have infertility issues is because it's a little bit personal. I also suffer from PCOS, and it does affect between 5 to 10% of women, and it's actually one of the most common reasons for anovulatory or irregular cycles, and is one of the most common reasons that I've found anyways personally of infertility from the female factor. So PCOS is defined by a collection of symptoms. Mainly they have irregular ovulation, elevated androgen levels, and ovarian cysts. And I'm going to go over each one of those a little bit here in a second. To be diagnosed with them, to be diagnosed with PCOS, providers are looking for 2 out of the 3 of those symptoms. So like I was saying, the first one is irregular ovulation. So your menstrual cycles may be more than 35 days. Women with really extreme cases only get 2 to 3 cycles per year. So never mind just skipping a couple, they really don't get them almost at all. So any kind of irregularity in your cycle, be it long cycles or like myself personally, I usually hover right around the 35-day mark. They can be a little shorter or a little bit longer, but I vary anywhere from 25 to 65 days, or 28, sorry, to 65 days. Just depends on the cycle. So I'm pretty regular, but I am less irregular than a lot of people that I talk to. One of the other symptoms is elevated androgen levels. So androgens are considered, typically anyways, to be sort of male hormones. They're also made in the female body. It's normal for them to be there, but they're usually converted to estrogens in the female. Higher than normal levels of these androgens result in symptoms like acne, excess facial hair, excess body hair, and you may notice these symptoms in yourself, or your provider may be looking at these symptoms or be looking for this excess hair and this excess acne to sort of help confirm the PCOS diagnosis. And the other one of the 3 sort of more important ones that they're looking for is ovarian cysts. It's common for the ovaries to be enlarged and contain lots of small cysts along sort of the outer edge of the ovary, and they look like a string of beads when they're viewed on an ultrasound. So that's why ultrasounds are really common in women when they're doing the initial testing to figure out why you might be having fertility issues. The little ovarian cysts are actually small sacs that contain immature eggs, and they're waiting for signals for ovulation. But there's a communication breakdown within the ovaries that are required for this egg development. So you end up with a whole bunch of tiny little eggs that are just immature sitting on the outside edge of the ovary. And they do really look like a ring of pearls if you ever ask anybody to see your ovaries. This breakdown in communication for egg development is what makes ovulation either erratic or just absent altogether, depending on the person. The problem is without ovulation, there's no progesterone. No progesterone means no period, which is what's accounting for those irregular cycles. Some other symptoms that your provider may be looking for, they're not the 3 classic symptoms they're looking for the diagnosis, but these might be associated. You may have limited cervical fluid over long periods of time. For myself, my cervical fluid is completely erratic. It doesn't correlate at all with my monthly cycle, like it does in a lot of other people. So tracking it for me is totally useless. You may have frequent patches of fertile quality fluid, which may or may not ultimately lead to ovulation. And just like I was saying, mine are totally non-incoherence with where my ovulation actually sits. You may even get male pattern hair loss. Obesity is another really common symptom. It's in about 50% of PCOS patients. So it's definitely not an inclusion or exclusion criteria, but it is definitely very common to be like me and have a BMI that's definitely on the overweight side of things. And infertility is also very common with PCOS. Not every PCOS patient suffers from infertility, and not everybody that suffers from infertility is suffering from PCOS. It's just something to kind of keep an eye out for. Some basic testing that your provider might do They're probably going to do a panel of blood work when you're starting to go through the infertility process. When they're looking for PCOS, they're looking for things like your androgen level. They're looking for elevated luteinizing hormone, which is the hormone that tells your body to start maturing that egg and start to ovulate, which in PCOS patients fluctuates without actually necessarily having an ovulatory cycle. Elevated, I'm going to try and pronounce this, anti-mullerian hormone, which is associated with excessive antral follicles, may also be checked, and the antral follicles are the ones on the top there that they're looking for. Other disorders must be ruled out prior to a PCOS diagnosis, and they're looking for things like thyroid function and that kind of stuff. They may also do an ultrasound, and like I was saying, they're looking for that ring of pearls on the outside of your ovaries. Yeah, basically the cause of PCOS is unknown. It looks like though genetics does play a role, as it tends to run in families. The insulin resistance may also contribute to development of PCOS and occurs in about half of PCOS patients. The problem with excess insulin is that it causes an increased production in those androgens, which is why some doctors prescribe medications to improve insulin sensitivity, even though you're not diabetic. So that's where in people you'll hear about some PCOS patients taking metformin as part of their infertility regimen to try and conceive. This may also help reduce your risk of developing diabetes later on. As stated before, about half of patients are considered obese, which means we really have to pay attention to our overall health, because PCOS patients are more at risk for high blood pressure, high cholesterol, heart disease, type 2 diabetes, metabolic syndrome, and even certain types of cancers, including endometrial, breast cancer, and ovarian cancer. Studies have shown that losing as little as 5 to 10% of your body weight can improve ovarian function and increase abilities to conceive within 6 months of the weight loss. Weight loss obviously doesn't work for everybody, and it's not some quick fix, and it's not an all-covering fix, and that if you lose 5 to 10% of your body weight, you'll absolutely get pregnant within 6 months. But it does definitely increase your risk. So when you're talking to your doctor and they're bringing up the mention of PCOS, and they bring up the fact that they want you to lose 5 to 10% of your body weight, it doesn't mean that they think you're fat and they need you to drop it. It's just that studies have shown that dropping that 5 to 10% can drastically increase your chances. So we mix that with taking the medications and doing everything else to increase as much of a chance as we have of you getting pregnant as early as possible. So what are some treatment options beyond just help for insulin resistance and being mindful of your overall health? Thankfully, there's some pretty simple medications that help induce ovulation. Clomid was previously used in a lot of cases, but they're starting to sort of cycle over to using Femara more often now. It has the same effect of inducing your ovulation. It just has fewer side effects in most patients. If you've ever watched anybody go through a Clomid on YouTube, you've seen the insanity that it can cause. It causes them to have hot flashes and emotional mood swings that are insane. And Femara tends to not be like that in most cases. And the other wonderful side effect it doesn't usually cause is the thinning of the lining that Clomid can cause, which can, ironically enough, cause problems with you conceiving properly. If the Femara or the Clomid doesn't work for you, they also have gonadotropins that they'll usually use in tandem with one of those two oral meds. The gonadotropins are an injectable medication. They stimulate the pituitary in your brain, which in turn stimulates the ovaries. It mimics the mid-cycle LH surge that you usually see that causes the early maturation of the eggs. The only problem with gonadotropins is they have a significantly higher risk of multiples. I think it goes up to like 30%, so almost 1 in 3 pregnancies becomes a multiple. Surgery is rarely used for PCOS patients, but occasionally you'll hear people have something called ovarian drilling. It's a laparoscopic procedure, meaning they put a couple of small holes in your abdomen, and then they insert tools that drill small holes in the surface of your ovary, up to about 10 times per ovary. This drastically reduces your androgen hormones, usually within days of the surgery being done. And it can help with patients where medications themselves have totally failed for you. The only problem with getting the surgery done is that it can cause adhesion formation or ovarian failure if there are any complications during the procedure itself. IVF is another option for PCOS patients. It's usually held as like a last-ditch reserve option, but it's definitely more costly than the average medications themselves. Yeah, so it's just kind of my rant about PCOS for today. I've been reading 2 books if you guys want to kind of pick up and read where I've been to. I've been reading the Mayo Clinic Guide to Fertility and Conception, and I've been reading the Taking Charge of Your Fertility book as well. They've been huge helps in trying to figure out my own fertility and trying to figure out what I can do to increase my risk or my chances of conceiving quicker, being that I'm a PCOS patient. And yeah. Thank you very much, guys, for following me again. If you like this video, please hit like and subscribe to my channel. If you would like to see a different topic come up in the next few weeks coming up for TTC Tuesdays, just drop me a note at the bottom and let me know. Okay, I will talk to you guys later. Okay, bye.